In this module, we're going to talk about innovative treatments. So if you play in the sandbox of imaging, you realize that there are actually many ways to heal the brain. So we're going to talk about some of the outside the sandbox ways. We've talked about supplement. Acupuncture, there's actually a whole imaging literature on how acupuncture can increase blood flow to the brain, how it balances the brain with pain in a non-narcotic way, and it can help with addictions and depression. In fact, a little secret is if your depression gets better with opiates, don't give them opiates. It's a very bad idea. Send them for acupuncture because acupuncture tends to work through an endorphin mechanism in the brain. A really crazy idea to treat depression is sleep deprivation. So it's called chronotherapy, in part developed by my friend Joe Wu at UC Irvine. That's really interesting. Hyperbaric oxygen, I'm just a huge fan of. Published a study on soldiers coming back from Iraq and Afghanistan with blast injuries, hyperbaric oxygen, significant improvements in blood flow, mood and memory, vagal nerve stimulation for depression, TMS, repetitive transcranial magnetic stimulation. We actually do it in our New York office and in our Costa Mesa office. I'm a big fan using magnets to heal the brain, light therapy for seasonal affective disorder and sleep disorders, lenses in the Irlen syndrome, neurofeedback, cranial electric stimulation, and playing brain games. So when I think of innovative treatments, I break them into 7 different categories. So there's mind-body interventions like biofeedback, relaxation, meditation, body-oriented exercises like yoga and Tai Chi, hypnosis and guided imagery. I think of all those as sort of mind-body interventions. But there's bioelectromagnetic therapies. ECT is one. Now, I rarely send someone for ECT because I think there are other things that can get resistant depression that are less toxic to the brain. There are about 15 or so spec studies with ECT, but there are also many with TMS, several with vagal nerve stimulation. There are also alternative systems of medical practice. So if you think of acupuncturists, homeopathy, naturopaths, chiropractors. Because chiropractors would fit in the manual healing method, as do osteopaths, physical therapists, and massage, pharmacological and biological treatments. So medication would certainly work, but light therapy is a biological treatment. Sleep deprivation, Irlen lenses, hyperbaric oxygen, herbal medicine, plants and extracts. We've talked about some. Diet and nutrition. So for example, vitamin E for blood clots and stroke prevention, folic acid for neural tube prevention, ketogenic diet for epilepsy. Let's look at some of these. So cranial electric stimulation. Generally, think of it like a TENS unit that you put either on the forehead or on your earlobes. There's a fairly good science for it, especially for depression, anxiety, pain, and insomnia. The modern devices use a very low frequency, 20 to 60 minutes a day, and there are companies that produce these devices. AlphaStim is one. Fisher-Wallace is the other. So the AlphaStim on the left, Fisher-Wallace on the right. TMS, repetitive transcranial magnetic stimulation, FDA approved now for resistant depression. It's also been shown to be helpful for post-stroke depression. It's been used in addiction, in OCD, but what we do at Amen Clinics is we do scan-guided TMS. So if you have an overactive brain, we're going to make the setting on the TMS device to calm your brain. If you have low activity in your frontal lobes, we're going to use it to stimulate. So you can set the frequency either to 20 hertz, which is a fast frequency, 20 cycles per second, or 1 hertz, which is a really slow frequency. So if you have an overactive brain, you want to set it for a low frequency to slow things down. If you have an underactive brain, you want to set it to a frequency that stimulates it. Unfortunately, the FDA, what it approved was fast frequency. It doesn't mean you can't change it. It becomes an off-label use, but as long as the device is FDA approved, you can target the treatment based on what we see in the scans. And we actually have a very high success rate. It's up at 85% that people get better with TMS. You know, with TMS, most of the people that get it have resistant depression. So we feel pretty good about that. It's also been used for migraines and pain, Parkinson's, tinnitus, insomnia, and stroke. It's a really sort of burgeoning literature. Some information on pharmacological and biological treatments. So sleep deprivation, they've been using this for a long time. 1994, responders had increased cingulate activity. So when you have increased cingulate activity, it predicts a positive response to SSRIs, sleep deprivation, TMS, a lot of different predictions. Goodwin showed responders had higher anterior cingulate perfusion, which normalized after sleep deprivation. And then my friend Joe Wu found the same thing. High pretreatment activity in the medial prefrontal cortex. That's where the cingulate is. Seasonal affective disorder. Basile found overall increased brain activity in responders with light therapy than in non-responders. And just another word on seasonal affective disorder, it's happening more not just in northern latitudes, but because people aren't outside, it's actually beginning to happen in southern latitudes. So the Irlen syndrome we talked about a little bit, but let's revisit this. These are people who are sensitive to light, bothered by glare, sunlight, headlights, or street lights. With bright or fluorescent lights, they get tired, they have headaches, mood changes, restless, and they're not very focused. They have trouble reading words that are on white glossy paper. And when they read, and you have to ask them about this because they won't spontaneously tell you because it's so weird, words will shift, shake, blur, move, run together, disappear, and they have trouble reading them. They often feel tense, tired, or sleepy, even get headaches when they read, and they have trouble judging distance. And they have difficulty with things like escalators, stairs, ball sports, and driving. So I'm at the mall with my daughter, and her best friend is at the bottom of the escalator, and she's having trouble getting on because she just doesn't see it clearly. And my daughter's making fun of her. You know, I smack my daughter and go, I bet Danica has the Irlen syndrome. Because I already knew she was sort of struggling with reading in school. And so I actually paid for her to go get tested. And she had this thing called scotopic sensitivity syndrome, or it's also called the Irlen syndrome because Helen Irlen is a psychologist in the late 80s, early 90s who first developed this syndrome. The interesting thing is if they have these symptoms, we ask it on our learning disability questionnaire. What you see in the image are colored overlays. That these colored overlays, all of a sudden it'll take these words that are moving and it'll make them sit still so people can read them. Typically they come to a psychiatric clinic for anxiety, irritability, ADD, and when put on the colored filtered lenses or use the colored overlays, it goes away. More common in people who've had brain injuries, actually very common in my NFL and NHL groups. For our NHL players, we'll actually tint their masks of the right color. Not everybody responds to the same color, so you need to have it screened by a specialist. And my favorite story comes from a 42-year-old woman who came to see us for what I call the holy trinity of the Amen clinics, which is ADD, anxiety, and depression. One of our physicians noticed she had the Irlen syndrome and sent her to get screened. And at the same time, my nephew, who also has it, was over at the Irlen Center being screened. And one afternoon, I get a phone call from my sister, and I'm in with a patient. And I see that it's Joanne calling, and I'm like, I'll call her later. And then like 2 minutes later, the phone's ringing again, and I'm like, I'm gonna raise her medicine. I'll call her later. And then third time she called, I thought my mother had died. She's at the Irlen Center, our other patient is there. She's like, oh my God, Dana, you can't believe what just happened. So they have depth perception problems. When this woman put on the right color glasses, all of a sudden she saw in 3D. She'd never seen in 3D before. The doorknob came out from the door. The bookcase came out from the wall. She saw a guy that walked by that had a pot belly, and she blurts out, "pot belly," which is rude, right? And she's had a tremendously positive response. I talked to her doctor, and he was all excited about the response. So we scanned her ahead of time, and this was her scan. It's a mess. She has markedly increased activity here in the anterior insular cortex, but right here, this is the bad guy, the posterior insular cortex. And so because we had this amazing response, we actually scanned her the next day on glasses. And I'm like, oh my goodness, just calmed down everything. Her mood was better, her anxiety is better, her temper was better, focus was better. And I'm like a little kid, I'm like just really happy about this. But then 3 weeks later, the doctor came to me and said that this woman wasn't doing well. And I'm like, well, what happened? And he said, like Paul Harvey used to say, you don't know the rest of the story. So, when this woman was young, she was a prodigy guitar player and a gymnast. She was a highly talented girl. But because she couldn't learn to read music, she only could go so far. And at the age of 12, she got really frustrated, took her guitar by its throat and broke it and never played again. So now she's 42. She's just diagnosed with the Irlen syndrome. She's fixed. I mean, basically, it's just colored filtered lenses. So why is she depressed? Because she begins to mourn the loss of what could have been. If I only knew. Should her doctor have put her on Prozac? Maybe not. Maybe it's to actually deal with the real issue of loss in her life and get to a point of mourning that, but then be excited about the future. And in gymnastics, she could only do well with her eyes closed. So she'd memorize her routine, and with her eyes closed, she could do them. Whenever she would open her eyes, she would get confused and disoriented. This is very important not to miss. And it's not that hard to diagnose. Are you sensitive to light? Do you have depth perception problems? When you read, do words or letters move on the page? If you get any sense that that might be there, send them to an Irlen screener. And you can learn more about this if you go to Irlen, IRLAN.com. Hyperbaric oxygen. So I got interested in it mostly because there's a SPECT literature with hyperbaric oxygen. So when people go into an oxygen chamber, they have increased blood flow to their brain. Here's a case from my friend Richard Neubauer of a 4-year-old who had CP, was diagnosed at the age of 6 months. So the time to treatment was 3.5 years. The baby had 150 treatments, and the results were better cognitive function, better gross motor function, less spasticity, talked more and interacted more. So I'm pretty excited about that. And when you look at the SPECT scans, significant improved blood flow, especially in the back half of the brain. Here's an unusual TBI case, a 41-year-old who was totally blind from an indirect lightning strike. Time to treatment was 5 weeks. They went to a famous clinic in Minnesota that said the patient would never see again. After 59 sessions, the patient started to see shadows. At 73 sessions, now had vision of 20/25, and now they're working full-time with no further treatment. And you can see the damage in the occipital lobes in the back that was better afterwards. One of our NFL patients who had really low overall activity, and after hyperbaric oxygen plus the supplements, brain was much better. So another one of our players, George Visker, really low activity, and after hyperbaric and supplements, also better. I'm excited about it. There's a fair amount of controversy about it. The Army published a study that said, oh, it doesn't work, but they didn't do the protocol that most people do. Paul Hartsch, probably the world leader in it now. He's in New Orleans. He routinely does SPECT before and after. In fact, he'll do SPECT studies before and then after one session, because he says if it works after one session, it's likely going to work. Now, you need 40 sessions to get it to stick, but he likes to see if the brain is at least responsive. What imaging has taught me is there are so many ways to optimize brain function that you're not stuck with the brain you have. We can make it better. And what horrifies me is a lot of psychiatrists only have the hammer of medication. And I've seen medicines, and we've shown throughout this whole program that medicines can clearly help people. But what we often see at Amen Clinics is people come to us on 3, 4, 5, sometimes 17 different medications. And we often see those are toxic to brain function. So I just, I'm not wed. I just want to get their brain better. And so whether it's acupuncture or hyperbaric oxygen or supplements or TMS or cranial electric stimulation, I don't really care. I just want it to fit the principles we have. First, do no harm. Least toxic, most effective. Scan-guided treatment so I'm not throwing darts in the dark at people.